Hi everyone, I hope you're doing really well. I'm just making this video as I've had quite a few messages from patients concerned about accessing dental care and worrying about what to do when they've got problems now that we've closed. Now, dentists in our teams are one of the highest risk professions along with ENT and ophthalmology, as we're in very close contact with patients. Also, dentists perform procedures that generate aerosol, and if there was asymptomatic people who don't have symptoms but could be carriers, this puts our team at risk if we don't have the correct PPE, the correct protective equipment. Most dental practices don't have this at the moment. Soon there will be some dental centres that can manage these emergencies with the correct PPE. So the kind of dental issues that you may experience that may need urgent treatment would be large facial swellings, especially when it's causing difficulty in swallowing or breathing, any uncontrolled bleeding after dental extractions, any uncontrolled bleeding after dental trauma, and a severe toothache that's not managed with painkillers. If you are having toothache, I'd recommend you take some over-the-counter painkillers. We'd recommend you take paracetamol, making sure that you're following the correct dosage. There are some concerns with taking ibuprofen at the moment with the COVID-19 and potentially making things worse. There isn't real strong evidence on it, but as a precaution, try to take paracetamol where possible. Now, if painkillers aren't helping and it's affecting your sleep, then you would need to seek advice. So do give the dentist a call and they will be able to give you advice, and if necessary will prescribe you antibiotics. If the toothache is mild, so it's only comes on when you're eating or drinking or putting pressure on the teeth, then just try and have soft foods that aren't too hot or too cold. Again, simple painkillers should help relieve that. It's really important to maintain really good oral hygiene. Do make sure you are brushing thoroughly twice a day and cleaning in between the teeth, either with interdental brushes or with dental floss. That will help prevent a lot of issues. Things that aren't urgent are things like loose crowns, loose fillings, chipped teeth if it's not causing you pain, any braces that are loose or the wires come out. That's not necessarily an emergency, so we wouldn't be able to see you for that. But I am going to go through some little tips on how to manage these things at home.